The way that nuclear medicine works is that we have the patient, of course, with a specific need that requires a nuclear medicine technique. Then we have the radiopharmaceutical that is administered to that patient based upon what the problem is, and we can go into more detail later on that. And then, of course, we have the imaging system that is required to basically take an image of the distribution, of the biodistribution of this radioactive material. For example, suppose a patient has a metastatic prostate cancer with lesions in the bone. We want to know how extensive there is the metastatic prostate cancer in the bone. And we have a radio tracer which is specifically designed for going to sites of bone metastases where the bone is being repaired or is reactive to the cancer. So the patient is administered with this radiopharmaceutical intravenously, and then after appropriate amount of weight for the radiotracer to be distributed in the body, then we position the patient in a camera system. And as I mentioned, we have these gamma rays coming off from that radioactivity that is within the patient. And that gamma ray is detected by these imaging systems. And then we have computer systems which gather up these gamma rays and form an image of the distribution of that tracer, radio tracer, in the body. And then that image is presented on a computer monitor, which we can manipulate. We can, in fact, these are not always static images. We have lots of dynamic images that we do in nuclear medicine. So we can manipulate them. We can look at them in different projections, different contrasts, colors, and basically in combination with the clinical data that we have on that patient, plus other imaging that we have available, for example, anatomic imaging such as CT or MRI or other imaging modalities, to interpret what we're looking at. And we put it all together to generate a report that is basically discusses what we see and what does it mean from what we see.
What are the benefits and risks of nuclear medicine?
Chemotherapy is a treatment that uses drugs to treat cancer. It can be given to treat the primary tumour, reduce the risk of it coming back, or control the cancer and help relieve symptoms, improving quality of life. The usual drugs used are cytotoxic, that is, they kill both cancer cells and healthy cells. Other drugs, such as antibodies, can be used which specifically target cancer cells depending on the individual's needs. There are more than 50 different chemotherapy drugs which can be given on their own or in combination. The drugs given depend on your diagnosis, stage, and/or age. Chemotherapy can be given before or after surgery or radiotherapy. In some situations, chemotherapy can be given with radiotherapy. Chemotherapy can be given in many different ways, but most commonly it is given into a vein in tablet form or into the spinal fluid. Most often, chemotherapy is given into a vein by a cannula. It can be given in the day unit, which takes between 3 and 8 hours, or the inpatient ward. If it is difficult to site a cannula or the duration of the treatment indicates it, a central line may be indicated. These include a PICC line, Hickman line, and portocath. If one of these lines is indicated, it will be discussed in more detail by your specialist nurse. All cells, including cancer cells, divide and replicate themselves. Chemotherapy interferes with this process. Drugs travel in the bloodstream and therefore reach cancer cells around the body. The cancer cells take up the chemotherapy drugs from the bloodstream. Chemotherapy also affects normal cells, which lead to side effects such as sore mouth. Normal cells usually repair themselves, but cancer cells do not have that ability and eventually die. Damage to normal cells usually is temporary and disappears over time when treatment is finished. Different drugs work in different ways and can be used in combination because of their different effects. When the drugs are given is carefully planned to maximize the effects of the chemotherapy drugs and minimize the damage to normal tissue and therefore the side effects.
Of the body does nuclear medicine help treat?
Well, nuclear medicine is used, as I said, for all organ systems in the body. Central nervous system, the heart and major vessels, for gastrointestinal tract, for urinary system, including the kidneys, for soft tissues, for bony skeleton, and the lungs. So basically, every organ system is touched upon by nuclear medicine.
How is nuclear medicine used in relation to treating illnesses?
Nuclear medicine is used for a number of very important illnesses, including cancer, cardiac disorders such as coronary artery disease, inflammatory disorders, infections of any organ systems, including soft tissue and bone infections, and brain disorders, for example, and gastrointestinal and urinary disorders.